Hi, it's the Implant Don. And I've announced it before, but now we're in. So we're going to be starting with our inaugural podcast series. And we're going to be doing a beautiful interview with a patient of mine that had a lot of complications from a previous clinician. And she'll be telling us her experiences, and we're going to have a communication. But this is the first now, and we're going to start firing. So the Don is here, and the Don is back. And the Don is going to start telling you where the bullshit in our field of implant dentistry and tooth replacement is, and who's ripping you off, and who's really taking care of you. I was going to swear, but I didn't do it. Okay, and I'm going to start letting it know. Okay, because there's a lot of phenomenal things in our field and people doing wonderful things for patients, and then there's a lot of shysters. Okay, going back to the days of the charlatans and back to the days of the Shylarks. People have always been taking advantage of people going back to before Christ, before I was even born. Go back to Israel, look at the old city of Jerusalem, and you're going to see people fighting about money and power. Well, you know, in our field, there's a lot of money and power, and then sometimes that's not the best. So the Don is going to set the story straight based on his 28 years of clinical experience, being taken advantage of, being in the situations, dealing with problems, dealing with complications, but then all the good things too, with publications and teachings and being respected by people for what I have done, which is good. So now we're going to let it fly. So get your cameras ready, because the games start now. Hi everybody, I'm here with our stellar patient, Allison.
Best doctor ever.
Oh, thank you.
That's true.
And this is such a unbelievable situation that Allison has been put into. And it's very, very unfortunate that Allison has been through what she's been through. And there's many, many people like Allison and similar situations that Allison has that are having similar problems and don't know where to go.
Exactly.
Or being told one thing and
Yes.
it's another and,
Yes.
and stuff. So
And you know things are not going well, and you know you paid a great deal of money, and you know that the person may not really have the skills because you're seeing the side effects when you don't have that kind of surgical technique.
and it's true. So this is where we're at in our field. Okay. We can do amazing things for people with dental implants and helping people reestablish a healthy facial profile, smile, chewing, digestion, all of these things that come with having teeth, okay? And unfortunately, patients have limitations on what they can get based on who delivers what to them and what they're being told. And I've always had the theme of the podcast being that the Implant Don, myself, is going to start calling this stuff out in our field, because somebody's got to do it.
Yes.
Okay.
Agreed.
And I'm at my age, in my experience level, I don't care anymore. Okay. I already got all the enemies I'm going to have. To make a few more is not going to really matter. And but
Yeah.
you know what, people, the public need to know, and
Yeah.
doctors and clinicians and
Yeah.
surgeons and prosthodontists that care
Yeah.
need to know.
Yeah.
Okay. And we need to start to be honest with what we're doing and what we're not doing. So
Absolutely.
what our inaugural issue is, and we've kind of bounced around with what I would do first, but when Allison agreed to do this, I can't figure out a better way to introduce what we're all about than have a discussion with Allison about kind of what's transpired in your life, which has gotten you to the point where we're here now.
Yeah, thank God.
So tell us a little bit about what's happened from the beginning, kind of your journey about, deciding you're going to do something, some of the, places you researched, what you went into, and then of course when you ended up in the situation you were, and then how we got together.
Okay, mine
And
is.
this is graphic, so you can be.
Mine is really, really kind of tragic. I always had dental phobia from the minute I first went to a dental office. No one could get me numb, and I had deep cavities, and I had the enamel taken off my teeth for various reasons, and so I had this intractable dental pain, followed up by the fact that I did everything they told me, and I could see that my gum disease was more advanced than it should be, and it became root canal, re-root canal, we're going to do veneers, we're going to do this, we're going to do that. And after hundreds and hundreds of thousands of dollars, I finally came to the conclusion that I had had enough. And this was when I started seeing on the TV the Eon clinics and the Clear Choice, which was, do you have failing teeth? Now, I'm 55 at this time, okay? And I'm a bit young for dentures, but I did have an implant. It did go well, and I thought to myself, this is where I want to be. I want to be done with it. And I want to have somebody that I trust, and I want to have it done in their office more so than these large group doctors, right? And I did understand that there were prosthodontists, there was anesthesia, but my dentist, who I did trust and I had seen for, at that point, 3 years, recommended an oral surgeon. And when I went to see the oral surgeon, I was very uncomfortable. It seemed to me like it was when you have the money, and then once you have the money, we'll make up a Panorax, and we're going to do these things. On the day of
what did he tell you were going to do? Tell me what
he told me he was going to do just simply the 4-on-1. He had a brand. Should I tell you?
Okay. No, not a brand.
Okay. So he had a brand, and it was going to be 4-on-1, top and bottom, same day. At that point, there would be 27 teeth extracted. That's a lot to me. And he assured me that I would feel no pain and it would be done in 4 hours. This was the guarantee I was given. Now, the reality is once I came in with the check, he did do the Panorex. He couldn't make the model of the top or the bottom with his assistant. And I asked about that and I said, when should I come back? Oh, it'll be fine. We'll do it the day of surgery. On the day of surgery, he had a form that he wanted me to sign about zygoma implants. Mm-hmm. And he said to me there might be a chance for a zygoma implant, but I don't know that you're going to need them, and I've never perforated a sinus with them. That's real important here. And then we had a sign. It was very nerve-wracking. I wasn't able to read. I later realized that the consent said that it could actually perforate my globe, and I was agreeing to this. So this is how anxious I was. So basically, I went in at 7 a.m. and I was done at 5:15 p.m. And I ran out his door. And I don't even want to tell you how bad things went. Not only did I get the zygomas, which he'd always planned on, and perforate both sinuses, he completely had missed the zygoma on the left and was somewhere in my floor of my roof, or floor of my sinus, I guess, having perforated something called the Schneiderian membrane.
Schneiderian membrane, okay. Sinus membrane.
I'm an internist, so
that's okay. No,
yeah.
It's
I was restrained. I was monitored in the bathroom. Bizarre things happened. I was given ketamine. I was overdosed on Do you want me to tell you doses?
Yeah. I mean, this is. Listen, you're a physician, so
I am.
This is even more important.
Okay.
Because you know what these drugs do. You know what these things are. 600
mics of fentanyl, 45 milligrams of Versed, and 50 of ketamine.
You still weren't sedated properly.
I wasn't sedated.
You were awake when this was happening.
I was awake.
Cognizant.
I was awake and cognizant, and they both were there, and they knew I begged them to stop twice. I grabbed his hand as he was putting in the zygoma and tried to have my husband come back. Wouldn't stop.
Yeah, this is
hell.
This is a very
worst nightmare.
Yeah.
Worst nightmare.
You already have the phobia.
Well,
phobia before this even started.
Yeah, this was like a living nightmare because with that much ketamine, there's a dissociative thing that happens, and so this is a street drug. This is a drug you use on animals.
Horses.
And this is something I never agreed to, and he was so desperate he wouldn't let me go.
Yeah.
And I literally thought I was going to die a couple of times. I woke. I didn't know what is that thing called when you're being waterboarded? Yeah.
The suction.
Well, I was bleeding so bad, and he kept on giving me so many drugs. I was hypotensive for like 6 hours, and I was in Trendelenburg, which is your head's down, and so I was drowning in my own secretions. Waterboarding?
Yeah, that's waterboarding.
Okay.
Torture.
Yeah, and so I'm trying to grab him, and what he did was he brought more people in to hold me down, and so I was absolutely terrified, and I begged for my husband to come back. Or my phone, because I would have called 911. I wanted to go to the police, but I kept passing out from the amount he'd given me, and I didn't know it then, but he'd given me steroids, and I was GI bleeding. So,
this is definitely something that should not be part of the protocol of how this is done. Right. First of all, not only myself, but the way a clinician should go into any procedure is you have to, if you're going to do these kinds of procedures, you have to have adequate
Skill.
anesthesia.
Right, and skill.
And there's, in my opinion, and I don't have all the answers. I mean, I did sedation for patients for many years, and I stopped because
Yes.
there's no way I can do this surgery
Thank you.
and have the sedation. I'm just not capable of doing that.
No, you're not.
And we use some really qualified people.
Yeah.
When we get into the zygoma for the public, these are the implants that go into your cheekbone. Sometimes when you don't have enough bone residual from what's been done, we have to go to some place in the remaining part of the skull, which is the zygoma, is this cheekbone right here.
Yep.
Right there.
Yep,
Mhm.
yep. You can feel the right and the left has been removed.
Yes. And there's different things we can do with really strong local anesthesia, and we can numb from the outside the nerves that are here, but you still cannot get adequate
Right.
local anesthesia
Right.
with this type of a procedure to
Right.
get access to the anatomical structures we have to.
Right.
So, having a good patient level of anesthesia
Which you never
is,
have.
or you have to abort, you have to stop. You cannot, you
Kisses! Kisses!
you just can't go anymore.
Thank you!
Yeah. One of the first things they teach you when you're doing your residency in surgery is they teach you something
You're gonna
about
make me cry.
baseline pain, and what you feel with an incision. And they talk to you about levels of anesthesia with this. I mean, this is not...
I know.
Listen, I've been doing this for 28 years, and I've been in situations in surgery where I've learned many things about patients and experiences, and there's times you just have to stop.
And they wouldn't.
Yeah.
They wouldn't, because to them, the one kept coming, sorry, I'm crying, kept coming in and saying, the treatment is not complete. And I was like, please stop the treatment. And they were just, it was like the nightmare of nightmares, I couldn't get to my husband, I couldn't get to my purse. I'm gonna be there until he's done with me. And it really felt at that point like he was enjoying hurting me.
Yeah, that's
Unbelievable. And I just was like, oh, she was the most challenging patient. I'm like, that's because I wanted you to stop, and you understood that. And they were like, well, you're a dentulous, meaning no teeth. And what my plan was to go to my local hospital, get the anesthesia, and get the oral surgeon. And these guys weren't trained. They weren't trained at all.
How much, if you don't mind me asking, and
Sure.
it doesn't have to be exact, but give me an estimate of what you paid for this.
Oh, well over 60,000.
Okay.
And got absolutely only this. And that they didn't fit. And the thing that was the kicker for me was the zygoma. He had to have planned that, because I saw the models, right?
Yeah.
You don't just sit there and drill out.
No.
He had always planned this, so he had lied to me from the beginning.
Yeah, and there are times that we will, in a surgery that doesn't have a zygoma planned, we will have to divert to this because there just isn't adequate bone quality. But that is a situation that a trained surgeon has to disclose to a patient in a discussion before anything is done, that there is a potential that this can happen. There is a potential.
And the cataracts in the model business, that
Yeah.
was fishy.
Well,
None of it.
I mean, first of all, you got to have a CT scan. You can't do this without having a 3D image of where you're at.
I know. I did.
And it's very
Horrible.
It's horrible.
Yeah, these are people that are out there. They're your local dentists. These are people that are not board certified, that don't have the skills, that don't have, when you do the search on them, the positive clinician things. And I don't know Yelp, how you feel about Yelp, but my dentist and my doctor had Yelp things about these, exactly what I was talking about. So sometimes that even is a help. But I mean, I was just horrified. It was like S&M, and I cannot explain to you. I was so destroyed psychologically, because this was what I'd always been afraid of. And my family will tell you that the drugs did something to my personality, and when I came home, I've been different. I've had to almost relearn who I used to be. That's how bad this was. And
Well, it's a
Yeah.
PSTD.
Yeah, right.
It's trauma.
Absolutely.
It's stress.
Absolutely.
It's change of behavior.
And I'll tell you what I did, okay? I did go the legal route, and I did look around, and I did look at the state, and you really have very little recourse.
That's what's really a shame here. I mean, accountability for these actions are sometimes
None.
It's difficult for a patient. A malpractice lawsuit is one thing.
They don't,
But
nobody's.
nobody.
I was told by one lawyer, you'll like this one. I was told by one lawyer, maybe if you died. That's how little. And everybody was like, well, of course they have to be in your sinus. Are you stupid? Do you not understand? You know, you signed that consent.
Well, here's how bad it is. I have another patient
Oh, God.
who came in to see me from Oklahoma City.
Yeah.
And the doctor, her referring doctor, is a doctor that I have been able to give some instruction to. He's a very good clinician.
Okay.
You know, the patient sought him out.
Yeah.
You know, she had gone to an oral surgeon who had done similar things, but no zygoma.
Yeah.
She had 4 implants, it's called the all-on-4. She had
Yeah.
4 implants in the bottom that were done at different angles, which was failing. Matter of fact, when I met her, she had no lower. When I did a consult with her over TV with the restorative clinician, she was wearing nothing.
Oh,
she had a
wow.
final zirconia bridge on the top, on 5 implants. 3 of the one implant was not even attached to the bridge, it was in her nose.
Yeah.
The other 2 implants were in her nose, but she had a broken drill bit in her right nasal concha that the surgeon left there and didn't even tell her that it was there.
Oh my God.
And when I told her, when the referring clinician, Dr. Brittingham in Kansas City, told her that she had problems, this was there, she was mortified.
Yeah.
And
Yeah.
I told her, and we had a very nice talk over on the internet, and we had we spent a long time on the phone, on the internet, and she decided to come up, and we
Amazing.
met her,
Yeah.
and she'd like to have treatment, and I told her the morning of, I mean, we had planned then, this is now a total revision, everything had to come out,
Yeah.
top and bottom,
Yeah.
and we had done 4 new implants on the bottom, like I've done for you so far.
Which are amazing. I can tell the difference.
Good,
I can't wait for the top.
good.
So-
we'll-
And the sarcoma. I can't believe I'm saying that.
We're gonna.
I know.
We'll talk. We're gonna get.
I know.
We're gonna
I
help.
know.
We're gonna
I
take
know.
care. We're
I
gonna
know.
take care.
I love him. I do.
Thank you.
I do.
But this is, you know, what we're doing for people is we're supposed to be helping people.
Yeah.
Okay. Now, you know, not everybody is perfect, and things
Right,
happen. Things
right.
can happen.
Right,
Okay.
right.
But you have to be able to solve what happens. You have to be able to.
Listen to the patient
Yes.
and admit you don't have the skill.
Yes.
And don't distort and lie to them because you want the money. I think the dentist, my dentist, was watching this horror so that he could do it.
Ugh.
You know, you either have this kind of skill, because it's about the, you know, abutments and the angle. And if you have somebody grabbing your hand with the drill, you cannot be drilling in their hard palate.
No.
You have to stop.
Yeah. It's amazing. It's amazing.
Yeah.
And
When-
you know, you have to communicate. You
I know.
have to, you can't just like make believe this stuff doesn't exist.
No, you know, when I saw you, I was told there was 2 out of the 4 on the bottom. You guys were kind of like, and let me help you with this. I had a board. No, he wasn't certified. I had the best guy in my area who agreed, you know, like a king, agreed to see me, who told me the bottom's set. I've made the restorative thing. You don't need any work. And I started spitting up blood, right? I couldn't tell where it's coming from because everything's bad. And I figured out it was the bottom. I went to Dr. June, who is board certified, who I found on my own without anybody helping me. I was very impressed with his credentials. He brought me, he said, you need to meet Dr. Paul. I'm like, oh no, 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 oral surgeon, please end my life here, you know, whatever you can do, because I like Dr. June, right?
Yeah.
And he said to me, he goes, he's really gentle and he's very good, Allison, and I think you should really think about it. No, because I'm still in that mode. So I went to the psychiatrist and I told her what was going on, and she made some adjustments in my medicine, and we went to a counselor and we worked on, you know, seeing you.
Yeah.
And then when I saw you, I was having a huge fight with my husband, and I couldn't take the sedation, so I had to drive myself. So I drove myself here without sedation. They don't have any nitrous. I'm the sort where I had sedation, nitrous, people holding me down, let's talk her out of it. And you worked on me, and I did, actually for me, very well. I know I cried, but that was
okay.
more
That's
because
okay.
of the whole relapsing of what had been done to me. You did not hurt me at all.
Yeah.
At
And
all.
anesthesia with local was fine.
Amazing.
You had it done with local.
How did you do that?
You know,
Why can't you teach others? Because others can't do that. I mean, when he gives a shot, you guys, the initial part is like, there is absolutely no pain. And you know I've had a lot of this. Okay, absolutely no pain. And then the deeper shots, absolutely no pain. I've had people do those, and it feels like a saw is in my neck, right? And they lasted, and I was able to do it, and I was so proud of myself because I was like, I'm doing this with you, and not 2, but 4. of which two had sort of integrated, and I could feel it and hear it, but you were just so flippin' amazing. And it was like, you realized that you were like in butter, and you were so consistent as far as, no, I want this size. And I mean, you had your office bring me one. I mean, the other guy would go out and there'd be a pile of dog shit, and he'd pull one out and he'd say, this is fine. I've had somebody do that to me. Drop it on the floor and put it back.
Yeah. That's you can't do that.
Sorry.
This is what we were saying. No, but this is good.
It's true.
This is real. This happens.
Yeah, and there's people out there that are so interested in the amount of money with this, because it's not something you bill with insurance, but they want that $50,000-$60,000. They're just going to learn from the lab technician. I had one of those too.
That's the problem, is that any type of procedure that we do, anything like this, all on four.
Yeah.
And we all have to start someplace. It's lucrative. There's it's made to be talked about, that it's so nice and it's easy to do, and you go in one day and you leave with teeth the next day, and you do all this, and it's a very, very traumatic procedure for patients.
I would agree.
Even done in the best way, it's aggressive.
I would agree.
I mean, I myself, I've done a couple thousand arches, and we're on a newer technology now, which, to be honest with you, I just gave a big lecture in Germany on complications of upper all-on fours, okay?
Yeah.
And one of the things that I talked about, there was somebody talking about the pros of the procedure, and of course, 35-40% of my practice is failures. I have a wealth of information. For 5 years, I was contracted to fix one of the groups you had discussed all their failures in the Chicagoland area. And I can't even tell you what I saw for those periods of times.
It's horrible.
It's horrific.
Yeah,
okay?
it really is.
It's horrific what I have to do to fix some of these things. And it shouldn't even be the case. Once again, implants can sometimes fail.
Yeah.
Things can sometimes happen.
Just
nothing is perfect and nothing is 100%.
Yeah.
But I think the general public, and I think clinicians like myself, have to understand that there's limitations, and that not everything is so easy, and not everything is so perfect, and things like this have to take time, and and you have to allow. Now, there's unbelievable technologies that we're doing, like I was discussing with you just off camera. Now we're doing this less bone reduction.
Yeah.
Can go to final teeth within 48 hours.
Oh, can I say that? The other thing nobody warned me about is how much bone loss I've already had from what they did. I mean, I look at myself, and this is the one where they had to remove part of the bridge and the zygoma because it wasn't even attached. And I look like I've aged 15 years. Now, part of it was when I left, because it was so traumatic, and I ran out like a football player trying to dodge these people with mirrors going, don't you want to see your pretty teeth? I'm like running out for my life to get in the car, to vomit in my car, and go to the police and report them. And my husband's just like, what? Why do you look like this? Because there's blood everywhere. I'm swollen. I'm having this dissociative ketamine thing, and I'm insistent upon going to the police. And my husband says later, this is what he said, Allison, they would have thought no dentist, an oral surgeon, would ever have let you leave like that. I was never offered ice, right? It's like 12 hours or 10 hours, and they would have arrested me for spouse abuse. That's how bad I looked, because they couldn't keep me anesthetized.
Where we're at right now with Allison is we've gotten into the revision of the lower jaw, which has been successful.
Oh my God, the graft. So they left me with, like, what would you say, like an inch and a half, 2 inch hole?
Or the hole, yeah. So it was probably an inch.
Just a truck could drive through there, right? So everything I ate would go, well, they also had a fistula on the left, so food would go through my nose, right? And it would also shoot down and get caught underneath that denture. And, I just sat there and I didn't know what to do. I could see the abutments, right? And part of it going the wrong angle. And, I'm a physician, so I started reading up on you guys' stuff, and I sort of figured out the angles are wrong, and I'm like, oh, holy shit, what am I gonna do, right? Because there's nothing you can do now. And when I was told, that I was told the day that I left, it was having a poor outcome because I had a bad attitude.
Oh.
I had no idea how much bone they had shaved down, cannot be replaced. I have not got osteoporosis, osteopenia. I don't have any health problems. I've always had dental problems, right? So this was supposed to be my solution.
Was never I shouldn't say never, because I don't know everywhere in the world who does this.
Yeah.
But what's never really discussed about this procedure is that the all-on-4 procedure per se is the final teeth, the temporary teeth and the final teeth, which usually come 6 or 8 months later,
Yeah.
are acrylic, like
Yes.
a denture.
Yes.
Okay.
Yes.
Matter of fact, when we set up a patient situation, they make you dentures, whether you have all your teeth missing or not. It's estimated.
Really?
Oh yeah. And then in the surgery, that's where the lab or the prosthodontist or something,
Yeah.
we have to take those dentures and convert those
Yeah.
to the implants.
Yeah.
So the way to do that, like
Wow.
a denture, if you don't have implants, the way a denture stays in the
Yeah.
top is by suction into the palate.
Yeah,
And
right.
the bottom is by kind of going underneath your tongue, under your jaw, and holding on.
Right.
Now, acrylic is plastic.
Right.
So when you have to put the implants in, you need a certain distance between your top jaw and the bottom jaw. We call this like a freeway space where the acrylic has to be thick enough.
Right.
And that literally is from here
Yeah.
or here
Yeah.
to where your bone is,
Yeah.
about 18 millimeters in each jaw. So now that's 36 millimeters between each one. So what does
Okay.
that mean?
Yeah.
That means wherever your tooth is going to be, your planned position,
Yeah.
you have to have space to where your bone is of 18 millimeters.
Wow.
So now with having teeth in that you're having removed without gum disease, you're probably 10 millimeters. So that means you got to take 8 millimeters of bone away. Now, depending on what your jaw structure is, sometimes the bone reduction is massive.
That's what he did to me, I think. That's when
You know how
I.
many people go into those clinics, and because they're not being told what they want by their dentist, they're not, they may not like the way their teeth look or whatever.
Mine
But,
hurt.
they're sold,
Yeah.
a $50,000 solution to do
Yeah.
your upper and your lower at the same time.
Yeah.
And they're not told that we're going to take away 36 millimeters of your bone. They're not told that you're going to leave, with 4 implants in and temporary teeth that don't have molars on them,
No.
that you're going to wear those for 6 months, and then you're going to go through several try-ins, and then you're going to get your final teeth made after that.
Right.
There may be another charge for your final teeth.
Exactly.
What about the wear and tear? What about the
Right.
what about the abutments that the screws need to be?
Right.
Nobody ever talks about this
No,
because
no.
I'll be quite honest with you. They didn't have enough long-term success on this procedure when it started becoming mass-produced.
Right.
To know what the complications were 5 years
Right.
later and 10 years later and
Right.
15. And what do you do when you take all that bone away and a young patient like Allison gets 15 years later and they fail? Now where do we go?
There's no place I
Well,
can
see,
go.
this is the whole problem with this whole situation.
Yeah, because they don't tell you about that. They don't tell you that you can't have standard dentures, okay? They don't tell you they're taking the bone. When I look at myself now, it's really hard for me because I feel like, first of all, the post-traumatic part of it, but also I was so terrified about where do I go?
Yeah.
Who's going to help me?
Yeah.
And everybody like shuts the door and runs away as quickly as they can, and they go back to him. And I'm like, I'm not going back. He's the butcher, I call him. And then the other part of this is that my dentist is not an effing prosthodontist. What is he doing in that role?
Yeah.
He has no skill. And so then, the butcher comes in and says, well, I'm done, I got my money, you go. You have that attitude, you fail, And that's the leak of the air from the top. Sorry.
We're going to resolve that.
I know you will. I know you will. But see, my feeling is, as a physician and knowing you, is that there should be somebody out there who's monitoring this, because there's more than me. I'm telling you, there's more than me. The butcher even was talking about how, oh yeah, we went through her sinus too, and she was very painful for us to deal with. Who talks like that to me? Right? I had all these little clues, right? And I just wish there was more about, like, who should be doing this? Why aren't the states more responsible?
Well, you know what happens is that when a doctor finishes dental school, they're a general dentist, and they really have permission to do whatever they're comfortable with doing.
Absolutely.
Now, and it doesn't. I mean, the oath of dentistry, asks you to do what you think is right for people, to treat them in the best way that you can, and be, kind and considerate and compassionate, but do what's right, okay? And here's the problem. You can go on to specialize, but what good does that do you if you go to a program
Exactly.
where the clinicians don't really know what they're doing?
Exactly.
And how many people, and how many doctors, from residency, how
I know.
many doctors that are teaching at advanced education programs actually even practice?
Right. Okay. So it'd be like on my thing. Let's say I go. I'm an internal medicine doctor, right? So I have post grad 4 years, right? 2 internships and a 3-year MD. And I go to a class in Hawaii for 2 weeks, and it's to teach me how to be a plastic surgeon, right? No. There's nobody that would let me do breast implants and nose jobs after a 2-week course. Yet dentists can go even less time. They watch something, they say that they have the skill for implants because they watched the guy do the 8, so now they've got 8 in their pocket. My guy said that he had been doing zygoma implants for 2 years and was the doctor, and now I realize, you can't. You can't when you don't have a patient anesthetized. You can't.
Yeah, you can't. It's impossible.
You should stop. If I'm grabbing your hand, I'm still awake.
It's impossible.
Okay, so my point is that I came to Dr. June. I saw he's board certified. I, as an internist, am board certified. You are. Everybody should be in the same ilk, doing these complicated things, because these things you can't fix easily. And we're blessed that we have someone like you out there. No, seriously, that is truly as gifted. And not only with the shots, but with the whole thing. You flippin' did 4. I didn't even have any sedation. I cried because I was reliving the old shit.
Which we worked through.
But you were sweet to me. You didn't come in and say, that treatment is not complete. You know what I mean? You were supportive, and Dr. Jean was there, and you guys were collaborative, and I was madder than crap about my husband, and that's mostly what I thought about. That's never happened. I was shook. I've almost like had panic to the point where, I had to leave. I was very comfortable with you because you got me anesthetized, and you did work, and you did more work than we thought. I was so impressed. I went home, and then I realized I had to be in love with you because you are seriously the only oral surgeon I've ever met. And there's quite a few. So I really would encourage people that are out there, maybe in my condition, right? Because, there's a lot of people that have no teeth and dentures, right? Oh, that's a slam dunk. I was a person that had 27 teeth. And they were cemented, root canaled, everything, and I was like geared at it. But the gum loss was so severe, they weren't staying in. Yeah. And there were people telling me to do more root canals. Yeah. Okay, and I knew the pain was excruciating, and I'm a doctor. I don't want to be on the pain meds. I don't want anything other than relief. That's what I wanted. Yeah. And that's what the 4-in-1 said, is basically, are you having feeling teeth? But you need somebody like you.
And Allison is very kind with her words.
No, it's true.
But it's heartfelt, and it's what's important to me.
It's not kind. It's the truth.
I wish sometimes that everybody could understand this, because listen, there are a lot of clinicians out there, Allison. I'm not the only one.
I doubt it.
There are.
Well, I haven't met them till you.
But there are a lot of people around the world that care.
Maybe in other countries, but.
But what we all have to understand in this field, which I know now, is there are definitely levels of how you do something like this. And there's really no program that you can go learn this at. This is something that you have to build upon experience and have mentors that know. I had mentors. I have mentors.
I'm sure.
I have a prosthodontist that taught me a lot. I've got mentors, my great friends in South America who mentored me. And from my experience, you have to.
Don't you remember? I mean, I was awake, the whole time, and I remember you guys sitting there, and you're talking about the abutments. Do you want this? No. Do you want that? Do you know what I had the other time? I had them cramming in the lower one so bad that it was lacerated. Okay, I had to go to an ear, nose, and throat. He said there's actually a linear laceration from them doing this, and they ripped my lip. Okay, you came in and you brought in Vaseline. I think I started crying at that point because I asked for Vaseline. The guy took it, threw it at the wall, and said we don't need that, and then just actually ripped my lip. When your lip rips, it doesn't rip like in the center. It rips in different parts. Yeah. And so, they're ripping my lip, trying to thrust this thing in. And you guys were so adorable. Just adorable. Well, let's do this. Okay, all right, let's go back. I couldn't believe the difference between the trained people and the charlatans.
And here's trained, like you said, it's Dr. June Han is your prosthodontist.
Yes, who I love as well.
June very, very closely. And,
yes.
And this is a collaboration.
Yes, very much so.
Unfortunately, what's going on with a lot of this is that the laboratory technician actually drives the surgery and the surgeon.
Yes.
This is just like,
yes.
You know.
You shouldn't do that.
No.
And teaches the clinician in some cases.
And it's happening right now someplace in Chicagoland area. It's happening right now around the world.
All of it.
And
Because
the lab techs, they're smart.
Yes.
Okay?
Yes.
They have a
Yes.
fee that they charge
Yes.
the doctor.
Yes.
Then they charge them to come to the office.
Yes.
And then they
teach
treatment
them.
plan and convince the doctor or
Yes.
surgeon
Yes.
to do a certain thing, which is maybe not the best from the approach standpoint.
Yes.
Okay.
This
and
is,
in the state of Illinois, lab technicians should never be putting their hands in anybody's mouths.
I know.
And I've observed this.
I know.
Where the lab technician is doing the impressions and the conversions.
Oh, they're doing it everywhere. I had two of them. I had two of them do that. And this thing that terrified me was on one of them. This wasn't the butcher, but on one of them, he was taking the zygoma implant. And he had removed the plate, right? And he took the a probe and he was just hitting it. And of course mine aren't well secured, right?
And it's resonating.
Right, and I started crying and he goes, oh, look at Allison, look at her levitate. And then he started wrapping tape around it and the lab tech finally arrived and I'm crying, right? And the lab tech arrived and said, don't do that. And he goes, why, you want to see her levitate? I was horrified. I was absolutely horrified. And I lost it. Then I just got up. I said, give me my crap in a baggie. I'm going to the ER. And he dropped the screw on the floor, put it right in my mouth. Refused to do anything. And that's going on. I'm not lying. These are true stories.
Well, and Allison is telling the truth because, you know, unfortunately, I see people like Allison way too often.
Yeah.
And, you know, it's just not managed the right way.
I know.
So at this point, you know, thank you. We're here to help people. We're here to help people. And once again, I'm not the only one, but I did tell you, and Allison, I'm so happy you're here. And I feel I have a very nice rapport with you, and we're going to solve your top issues and have you comfortable.
I know that. And can I tell you something? When I got the door shoved on me, right, I couldn't talk. I couldn't talk because I sounded like this. And then the other part of it was I was always biting things, right? So I would be biting either my lip or my tongue and bleeding, and I couldn't work. And I was going to get fired. And everything was falling apart. And I was going deeper into this depression because no one would talk to me. No one would help me. No one, even from dental schools. I tried Milwaukee, I tried Chicago. No one would help me. And Dr. June was a little reluctant. And then he brought you up, and that terrified me just deeper than piss. You know that, right? And then all of a sudden, it started to go well. And I was like, oh my God. And then I got the different advice. The bottom needs to be redone. I'm like, no, it doesn't. The other guy, I paid, lots of money for this. And he says it's fine. He's like, do you see this? And that's what the other thing. Look at the Panorex. Look at the osseointegration. And I'm like, oh my God. And the big hole, the crater that he had made. And then the abutment. And then I was like, because by now I decided I was going to help and learn a great deal about this stuff. And,
Yeah, for sure.
But I met you and I read your stuff and it can't be true. And it was. It is true. He is that skilled. You are.
Well, thank you.
No. You got to understand. First of all, I am not being kind. I'm being honest. I'm trying to really reach out to people that have been hesitant or terrified or have any kind of like reluctance. Because you know what? A lot of us just feel like we're done. There is no.
It's true. People don't, and unfortunately, when you have these problems, when you don't know where to go, the dentist or the clinician they keep you and it's going to be okay. We'll evaluate in 3 months. You need a little more antibiotic.
Narcotics. Here's narcotics.
It's just it's unfortunate.
Yeah, it's not what I wanted. And when I was told that I might have had an osteomyelitis. Right? I'd had 7 months of antibiotics and I couldn't find anyone. They kept saying, go back to the butcher. I'm like, no. Nobody would touch me, right? And the thing is, when you've had the 4-on-1, it is like a death. It's like, you've lost your teeth, right? I wanted the pain to go. I didn't realize you needed, and I'm a doctor, so I should have known better, right? I didn't realize you need teeth for not only aesthetics, but to talk and to, be healthy. And no one talked about the effing bone loss. So I look at myself, I'm like, whoa, I'm 80 years old, And then I'm told you can't get dentures now because you have no ridge.
You won't fit.
Yeah, you won't fit. So now I have this failing mouth and I have no future and nobody to help me, and I'm just devastated. And I stayed like that, and I tried to work, and I couldn't. The medicines that they would give me for pain, because I didn't want narcotics, would make me sleepy, and then the counselor was telling me, you're so angry, and I'm like, I paid over $100,000 at this point, and I have nothing.
Yeah.
If anything, I'm worse. And then the miracle happened.
Okay, so here we are. I told you that the Don was going to start calling people out. And I'm not going to stop. So the public need to know that this stuff is going on.
It's so
Our
terrible.
field needs to know that this is going on.
Exactly.
And Allison's story, as tragic as it has been, is we're going to make it untragic.
I believe in
And
you.
Allison is gracious that she's sharing her story with people because people need to know.
Nobody else out there cares. I'm telling you, there's no lawyers, there's no state, I tried
Yeah,
everything.
our patient from Kansas City,
Yeah.
she tried, the people in Oklahoma City said, they just dropped her. She visited some other people. And, one of the things that I do is, and in your particular case we didn't, but with hers and on your top I definitely will, is we extensively clinically document everything, photographs, clinical photographs.
Yeah.
And and my patient from Kansas City was so kind, as you would be kind, as to allow me to use those
Absolutely.
pictures from an educational standpoint.
Absolutely, because
I mean-
you can actually see on my one, right? The angles are
Yeah.
wrong, and they're kind of like misplaced. And then you pop this in. I'm not even sedated. There's no IV Versed. There's no nothing. And I'm sitting there, and you're just going to town. You did all four.
And when we use anesthesia, we use trained professionals that are certified, that they know what they're doing and how they're doing, and how to manage the patient's expectations and what their comfort level is going to be.
But and thank you for saying we don't have to do nasal, because I with the implants and all that. I mean, they've got two in my nose that are pulling them. That's all that's hanging on by that.
Yeah.
That and a whiff. But I want to praise this man. I want to praise you so bad, because I think that this is a tremendous gift that somebody can help us, because when you get where I've been, you just get so hopeless, and your family just sees this, and everybody's like looking at you like, just get it over with, die. I mean, that's how bad this was. And I honest to God, never ever thought I would feel like that. I'm kind of a hyper happy person.
Yeah, but
can you imagine me
No.
in that hole? And everybody, oh, you're too complicated. Well, you go back to him. And then you, and that's why I love you. And that's why I believe in you. And I will do whatever you say, because I know you're going to fix this. And I don't know how you can fix this, because he fucked it up so bad.
We'll fix it.
But listen, you guys, listen to me. Don't ever, oh my God, if you want to talk to me, I'll be glad to talk to him one-on-one. I mean, I was put in a bath. I was put in a dirty utility room because I was bleeding so bad, face down.
Not good. Not good.
That's a crime.
It's not right.
That's not a post-op. Oh, let me show you my suite. Well, I was put in your dirty utility because I was so bloody. Never given ice.
You can't be managed or handled like that. That's
I
not
know,
right.
I
That's
know.
not right.
Well, you wouldn't. I know
No,
that.
right.
I know that. When you brought out the Vaseline, I was all happy. I was like, oh.
Good. All right, everybody. I want to thank you for your time, and stay tuned. We're going to be moving forward with our quote-unquote disclosure.
And come see him immediately.
We'll be happy to help anybody with their problems 100%.
Yeah.
We are here to help people and take care of people and do what we can to give you the
Miracle worker.
right type of work we can the first time, and give you choices on what you can and can't do.
I can't even imagine. I was misled, and I was practiced, and I'm a doctor.
Yeah.
And all I gotta say is the lay public, stay away from those boxes, okay?
Yeah.
They're not what they're promising. You need to have people that have skill.
Yeah.
Because if you don't, you will end up worse than you could ever imagine.
And remember our closing line: all out dogfight, one guy's left standing. That's how you know who won.
That was you.
Thank you, everybody.
Bye.
See you soon. Bye-bye.